Hey guys, Josh Treblowitz here with Full Code. Going to give you a walkthrough today of our newest case, case 83, with presenting complaint of fever and cough. This will give you a breakdown of the case and also learn a little bit about how to use the app. So let's get started. First off, as with any case, you're going to get your EMS report and triage nursing report right up front. Per EMS report, this is a 61-year-old male who's presenting with a syncopal event, meaning fainting. He was noted to be ill appearing at the airport and then subsequently had a syncopal event where a bystander helped him down to the ground. On initial evaluation by the EMS crew, he's awake, he's alert, neurologically intact, blood pressure is 123/74, heart rate 100, oxygenation is 71% on room air, and they placed him on nasal cannula. That's what that stands for there. Stable during EMS transport. And then on arrival here, your triage nurse notes 61-year-old male, cough, fever, and syncopal event. He's awake and alert here. She also notes recent international travel. That's going to be key to this case. He's febrile and hypoxic, and she puts him directly in a negative pressure isolation room. So let's go ahead and meet your patient. And remember, this is a new feature of Full Code. You have your attending up here in the corner. If you need help walking through the case, he or she can give you a number of different hints to guide you through the case, and can also point out some of the key differential items or key actions to help you walk through it. Now, these features are available on the easy or medium settings of Full Code, but they're not going to be available on advanced difficulty setting. So here you go. This is your patient, Ji Ping, 61-year-old male. So this gentleman, as you'll see, has recent travel exposure that's going to bear very significantly on this case. So he's a 61-year-old guy. He has a history, as noted, COPD and diabetes, and he presents with fever, cough, and syncope. And per the EMS report, which we already read, the patient was coming from the airport. He traveled from Germany and landed this evening. At the airport, he was noted to be ill appearing and then had a brief syncopal event where he was lowered to the ground without injury. An evaluation here, the patient reports that he is returning from a visit with his family in Wuhan, China. He flew first to Bali and then connected in Germany before continuing to the US. He reports other family members were also sick with similar symptoms. He's complaining of chest pain, or sorry, not chest pain, shortness of breath, dry cough, and fever. He has no chest pain. He recalls feeling dizzy and sweaty before briefly passing out. A bystander helped him to the ground. And at present, he complains of ongoing shortness of breath and ongoing nausea. So there is medications listed. He has no allergies. There's no relevant family history present. Social history is still active, smoker, no other notable drug or alcohol use. So we get to our review of systems and what do you want to know about this patient. So hopefully, this travel history has piqued your interest if you've been watching the news recently and you're thinking about the systemic things that can potentially affect a patient with a viral illness or respiratory illness. So what I'm going to look at here is I definitely want to ask him about constitutional symptoms such as fever and chills, which he has had. Ask him about cough, congestion, ear, nose, and throat symptoms because that definitely would be common with a respiratory illness. He also did pass out, remember, so you can't necessarily consider that be related to the illness. There could be another cause for that, and the most significant one potentially would be a cardiovascular event of some kind. So we want to ask him about other symptoms that might suggest a cardiovascular cause. He is complaining of shortness of breath, complaining of cough, so respiratory is also key. Systemic illness or infectious illness may have some associated gastrointestinal symptoms, so that's important to ask about as well. And then he did syncopize, so reasonable to ask about neurological symptoms or ongoing dizziness. Another consideration is you can often have rash with infectious illness, so I'm gonna ask him about any skin findings or complaints, and then you might have body aches, myalgias, or other issues related to the infection as well. So now you're starting to paint a picture of a gentleman who is, probably sick with some sort of infectious source. Note that travel history, been in the news a lot lately. And he's complaining predominantly of respiratory symptoms, but has some associated symptoms as well. So we're going to move on to the exam. As we always do, first up, I'm going to get some vital signs on him. We have our triage vital signs as well. And these, we note that he is a little tachycardic. So 105 or so. Blood pressure is 120s over 70s. Respiratory rate is a little up to 22. He's febrile. He is hypoxic. So let's move on to the exam. So what do you want to know about this patient, especially on the basis of those vital signs? First, airway is intact. He's awake. He's looking at you, talking to you. Breathing exam. He's not in respiratory distress. Circulation. He's got good peripheral perfusion. So what else do I want to know on the basis of these symptoms? So again, with a respiratory infection, I'm curious about ENT symptoms that might be associated. You can see some erythema of the throat, no other notable findings. Neck exam, it's normal. You might think about an infectious cause, fever, concern for meningitis. Not getting a strong history of that here, but certainly something to assess for in an exam. Cardiovascular, you know him to be tachycardic with a regular rhythm. Pulmonary exam, also finding some rhonchi at the bases bilaterally might suggest infections, suggest the presence of fluid. Abdominal exam is benign, meaning that it's non-tender. No remarkable findings on his abdominal exam, but that's relevant given some of his complaints. Also might do a neurological exam given his syncopal episode. That's normal. A skin exam also shows no evidence of rashes. So now I move to stabilization. What are you going to do for this patient? What does he need? So I'm going to make the argument, he's ill, he's hypoxic, he's tachycardic, but his blood pressure is pretty stable. He's awake and alert. He's not in respiratory distress. So that can guide your thinking a little bit. So we want access. We're going to start IV so we can get blood work, so we can give him any interventions he might need. And then oxygenation. So this patient is satting close to 90%. It's a little bit tachypnic, as we said. So I'm going to put him on nasal cannula. Part that's because he has underlying history of COPD. So, he may have a baseline mildly low SpO2. You don't want to give him excess oxygen more than he needs. And you can see if this corrects him, and it adequately corrects him to 96, 97% on the nasal cannula. And then with the tachycardia, the active infection, I'm also going to give him a bolus of normal saline. And you can see that's going to help our heart rate as well. So what are you thinking? What are you thinking about in this patient? This one leads you down the garden path a little bit. You probably know where we're going with this, but what do you want to be thinking about in a patient with respiratory complaints and fever? So, are there other infectious complaints you want to think of? So certainly just any kind of garden variety URI might cause this, or garden variety virus. Put that on your list. You also want to think about pulmonary complaints. Definitely, just could be a run-of-the-mill pneumonia. He also has a history of COPD. Maybe it's consistent with exacerbation. And then, if you've been paying attention to his travel history, there's probably one major thing on your mind. And that's a recent outbreak of the 2019 NCOV virus, the novel coronavirus originating out of Wuhan, China. So this patient has this suspicious travel history, so that's going to be your major concern here. So what do you want to do now with this patient in terms of investigations? What do you need in order to to fully treat him and get a handle on what's going on? So I'm going to order an EKG. He's tachycardic, he's syncopized, always reasonable in that circumstance. EKG is just showing a sinus tachycardia. No concerns there. So remember, you can zoom in like this, see it a little bit closer for better interpretation. And your interpretation will appear here on lower difficulty settings, but they're not going to appear in the advanced difficulty. So what else do you need? So you could employ bedside ultrasound here. Lung ultrasound would be reasonable, as would chest X-ray. So this shows lung sliding bilaterally, but B lines focally at the lung bases. And remember, that doesn't necessarily just mean pulmonary edema. That can also mean a focal consolidation or pneumonia. So what do you want in this patient otherwise in terms of lab work? So he is obviously showing signs of infection, so I'm going to argue a CBC is reasonable. He's showing signs of potential systemic inflammatory response, or at least hypovolemia or dehydration. So going to want chemistries as well. You could consider troponin, given that he had the syncopal event, he's tachycardic. It's not going to be especially high yield here, but you could consider cardiac markers on that basis. And then we always think about in a patient who has low oxygen, rapid heart rate, you could think about pulmonary embolism. But this patient, we have a pretty strong suspicion that this is infectious in nature and not related to PE. And a D dimer, if you order it, there's a good chance that's positive anyways, because of the inflammatory response that's going on. So if you do have a high suspicion for pulmonary embolism in this patient, which I don't, you might consider just moving directly to CT and not getting a D dimer. Now he's tachycardic as well in the setting of fever, so I'm getting a lactate to assess for underlying sepsis and as a marker of perfusion. You could put some LFTs on there too. Broadly reasonable to get a urinalysis to work up a fever. We think this is respiratory in source, but that's fine. ABG, his oxygenation is corrected. He's awake and alert. This isn't especially high yield, but you could consider it. What else do we need? So come back to this later. Otherwise, you definitely could consider blood cultures. And, with the respiratory complaint, with focal lung findings, you're going to want a chest x-ray too. All right, so let's run through those interventions, see what we got. So here we go. We'll let this run through. All right, so he's got a little bit of a leukocytosis. So white blood cell count is 14, so mildly elevated. Chemistries look pretty normal. His lactate is 1.5, and remember that's after you gave him the fluids, so this would have been a little bit elevated, but not dramatically. And then see that there's some mild abnormalities in liver enzyme testing, which is found in a fair number of viral illnesses. These are transient usually and will resolve after the infection resolves. Your analysis is negative, and here's your chest x-ray. This is concerning, obviously, bilateral infiltrates, all this fluffy stuff both sides, concerning for a pneumonia. And we have a suspicion for a viral pneumonia, but you don't have total guarantee of that either. So how are we going to treat this patient? So we gave him some fluid already. He had a good response in his heart rate to that. You could consider giving him a little bit more if you wanted to. You can either repeat that over here, or you can give him a different type of fluid over here. What else do we want to do? Well, he's febrile, so let's do something for that. And give him some Tylenol, help him feel better, bring that fever down. He has also complained of nausea, remember? So going back to addressing the patient's symptoms, you can give him some Zofran. Now, we have findings, remember, of infiltrates on chest x-ray. And so the patient, definitely has an infection going on. We're concerned by that, his hypoxia, his tachycardia, his fever. So, even though you have a really strong suspicion that this is viral in nature based on this travel history, you can't totally guarantee it. So it's totally reasonable in this patient to consider giving some form of antibiotic. So let's say we decide to give him Levaquin for community acquired pneumonia. You would have a number of different options here if you were going to move forward with it. If you're going to argue that he's more unstable or with systemic signs of infection, you could consider broad coverage for sepsis. Vancomycin and cefepime might be a reasonable initial regimen. But you're also, if you say, well, he's stabilized with a little fluid, his lactate's not abnormal, his pressure's not abnormal, maybe we just cover him for CAP. And give him, something like, a ceftriaxone and azithromycin, or Levaquin, or doxycycline. So in this case, we're not emphasizing, the antibiotic coverage, but it's entirely reasonable to give him something because you don't have, confirmatory testing at this point. All right, so now the last piece of this. So what are you going to do about this? This has been all over the news. Remember, patients with this virus, it's spreading very rapidly. There have been, at the time of this publication, about 800 or so deaths from this, about 40,000 confirmed cases in China alone, and spreading to other countries around the world. So, the key in this case is, you can manage this. You can take care of this patient. You can correct his tachycardia, his fever, his hypoxia. You can treat him and monitor him appropriately. But what else are you going to do? You're going to need a little bit of help. You're going to need to report this, and you're going to need to, prevent spread. So contact the state health department and they'll give you guidance. So state health department representative says, thank you for contacting us. Please make sure that this person under investigation or PUI is under appropriate isolation, which we've done already at the beginning of the case. And they also ask you to obtain specimens immediately and send them to the CDC for additional testing. And they will dispatch a member of their team to assist you. So definitely, this is a reportable event, something that you need to marshal local resources for in order to prevent spread to other patients and perform further testing. So remember, back here, we also want to get those special specimens, send them off to the CDC. And so your nurse says, thanks a lot. We'll put these on ice. We'll ship them straight out to the CDC. And now, so the last piece, diagnosis, disposition. What are you going to do with this patient? What do you think is going on? So, this case, gives you a pretty slam dunk background for this exposure. This patient comes directly via multiple connecting flights from Wuhan, China. So this is what we're concerned about, suspected 2019 NCOV. And what are we going to do with this patient? So, his oxygenation has corrected. His fever's come down, his blood pressure's good, his tachycardia is resolved. So I'm going to argue he's not sick enough for the ICU. But he's also a patient with COPD, with diabetes, and he's got bilateral infiltrates on chest x-ray. He still has an oxygen requirement. He's not going home either. And then the last piece, what are we going to do with him? He needs to be isolated. He needs to be in a negative pressure room. That's what we have to do. All right, so I'm going to finish off this case. Hand off. We're ready to go. Nurse says, are you sure? Yep, I'm sure. Awesome. All right, so I wrote this case, so good thing that I know the answers to it. So this is your results. Breaks down everything you did in the case. Remember, you can look into each category and see whether something was critical, recommended, or action was neutral. And then if you want more detail, you can drop into the answers and get explanations for each action, why that made sense in this particular case. We walked through a lot of the logic already. You could do this for each category. And detailed discussion then, don't forget as well, this is going to give you your breakdown, learn about the diagnosis, how you manage your patient, and some of the context of this. So, right now, CDC is giving guidance to identify a person under investigation with any fever or lower respiratory tract symptoms and close contact with a confirmed case, any travel history to the Wuhan region of China, and any ill patient requiring hospitalization who has traveled to any region of China. So give you a chance to take a look through this on your own. And that's it. So don't forget, we love you to rate the case, tell us what you think, give us feedback, tell us things that are right, wrong, good, bad. Greatly appreciate the feedback that you send our way. So thanks for playing. Enjoy the new case. If you like these, we'll keep them coming. Thanks a lot, guys.